Okay, let's unpack this. Have you ever felt that really unsettling disconnect? As if your mind and body are speaking completely different languages.
Or maybe you had a physical symptom, something persistent that just defies any simple explanation. Doctors are stumped, that kind of thing.
Exactly. Well, today we're taking a deep dive into something I find truly fascinating.
Mm.
The surprising and really the central role of the human body in contemporary psychoanalysis.
Hmm.
We'll be pulling out the most important nuggets of knowledge from a really rich collection of contemporary psychoanalytic perspectives. Specifically, we're drawing a lot from the book Relational Perspectives on the Body,
Hmm.
published by Routledge.
Right. And this isn't just abstract theory, is it? It's about getting into real experiences, profound insights. Our mission for you, really, is to get a shortcut to being well-informed on this, discovering how our physical selves are just so deeply intertwined with our minds or relationships.
Yeah, and even our capacity for healing. It's pretty deep stuff. Prepare for some aha moments, I think, and some genuinely surprising facts along the way.
Definitely. So maybe we should start with a bit of history, because for a long time, traditional psychoanalysis really struggled with what they called the body problem.
The body problem. That sounds significant.
It often led to this very distinct dichotomization of mind and body, treating them as almost entirely separate things.
Dichotomization.
Yeah.
Yeah, that word really highlights it, doesn't it? How these two, vital parts of us were often seen as independent. And the impact was pretty big, right? I mean, there was even a kind of atmosphere historically where analysts might worry about being seen as too Freudian if they focus too much on sexuality in the body.
Absolutely. It wasn't just theoretical. It showed up in the therapy room, in how people practiced.
That's a key point.
Yeah,
It's fascinating how that struggle shaped analyst training. You mentioned Stephen Mitchell.
right, yeah. Stephen Mitchell, one of the co-editors of the book we're drawing on, he made this crucial call, explicitly suggesting that the body was in need of theorization by relational psychoanalysts.
So he was pushing for it.
He really was. It sparked a whole new wave of thinking, urging the field to, bring the body back in more fully.
And that push led to some really interesting contrasts in training, didn't it? There's an anecdote in the source.
Oh, yeah, about the different advice supervisors gave.
That's the one. One supervisor from more classical background apparently kept saying, think body, think sex, think dirty when listening to patients.
Pretty direct, a very visceral approach.
Right. But then Mitchell himself, coming from a different tradition, was taught to think parental character.
Such a contrast. It just shows the different lenses, doesn't it? How varied, sometimes even opposing approaches could exist. Really underscores that historical tension around the body.
Okay, so connecting this to the bigger picture,
Mm-hmm.
how exactly does the body become this foundational thing for our sense of self, our connections? Where does that begin?
Well, it starts incredibly early, like right from the very beginning of life. Our source really emphasizes how our earliest bodily experiences, literally how we were held and handled by our caretakers, are just absolutely critical in shaping our basic self-image.
How we were held and handled.
Yeah. The idea is that our self is first and foremost a body is experienced being handled and held by other self. It's how our first sense of being, in the world is formed through these physical interactions.
That makes sense. And building on that, Winnicott had that fascinating idea about the skin, the limiting membrane.
Oh, Winnicott, yes. He saw the skin almost like a transitional object.
Like a child's security blanket, something that bridges inside and outside.
Exactly. The skin is simultaneously me and not me, both subject and object. It's this vital mediator, literally setting our physical and psychological boundary between our inner world and, well, everything else.
Wow. That's a really rich concept.
It is. And then there's the idea of ownership of the body and mind, which sounds simple, but it's profound. It suggests this ownership isn't just an internal thing that happens alone. To truly own parts of yourself, especially things tied to the very early pre-gender body.
Pre-gender, meaning before gender identity really forms.
Right, those very early sort of undifferentiated bodily feelings and the early maternal influence. The idea is one must name.
You have to name it to own it.
Kind of. It's through language and crucially through the therapeutic interaction where the analyst's own body and mind are present that we can solidify that sense of self, bring those pre-verbal experiences into awareness.
That's powerful. Naming is essential for ownership. But what happens when that ownership is fractured? Or when trauma gets in the way?
Yeah. That's often when the body starts to, well, speak. in unexpected, often distressing ways, somatic symptoms, dissociation.
Right. Trauma leaves these deep imprints, these sort of embodied narratives. Yeah.
Exactly. Take the case of patient M. She used her body almost like a suit of armor against trauma from repeated childhood surgeries.
Pursuit of armor.
Yeah. Her anorexia, for instance, it manifested as a kind of non-maternal body, maybe a way to distance herself from a female body linked to that pain.
Okay.
And her intense gym routines, they became a way to seek out pain that would, in her words, blanch out upset, depression, loneliness.
Wow. So seeking one kind of pain to mask another, deeper kind, that's chilling.
It is. And the source also mentioned she called certain foods the demonology of muffins.
The demonology of muffins. That
Okay.
says so much about the internal battle, the meaning attached to food.
Doesn't it just right? Then there's another really compelling case, Eva. She had factitious colon cancer, Munchausen syndrome.
So she was feigning the illness.
Yes, but it wasn't just deception. It was understood as her body's way of expressing profound childhood abuse. Her analyst used what's called a multidimensional therapeutic approach, which even involved, really unusually, accompanying Eva to medical appointments.
Whoa, accompanying her. That's definitely outside the usual analytic frame.
Absolutely. It highlights how flexible therapists sometimes need to be with the parameters when distress is so deeply embodied.
Yeah. And there were moments. The source mentions the analyst just offering wordless, empathic validation while Eva was, like, violently banging her head against a wall.
Just being present.
Mm-hmm.
A raw, powerful example of the body communicating when words just aren't enough or aren't possible.
Mm-hmm. And then Stacy's case.
Ah, yes, Stacy. Deep shame about her height. She created this elaborate fantasy self, Jennifer, a tall, intelligent Native American lawyer.
And she did this while sitting in front of a broken TV, right?
Exactly. It's such a vivid example of what we might call normal dissociation, the mind creating multiple self-states as a defense. And notice how the Jennifer self was physically tied to that specific setting.
It's incredible how the body can anchor these internal worlds, which also brings us to how the body can, like, hold information, right, in a potential state when maybe our usual mental pathways are blocked.
Precisely. And this can lead to what are called affective abreactions in the absence of semantic memory.
Okay, break that down a bit.
It means a sudden, strong emotional release or reaction, even when the person can't consciously remember the specific event or facts that triggered it. The feeling comes through, but not the story.
Got it. Like the body remembers even if the mind doesn't consciously?
Exactly. Like Mrs. O.C., after her stroke, she suddenly had these vivid childhood memories pop up, things previously inaccessible, long-forgotten Irish songs, the overwhelming feeling of being held by her mother again.
Wow. So the stroke somehow unlocked what her conscious mind couldn't reach.
It seems so. Her body, through this neurological event, allowed this powerful, visceral reliving of the past.
These embodied stories also touch on gender, don't they? The source notes something interesting there.
Yes, it points out that for boys, psychic disorder begets the healing, disciplinary practice of psychomedical intervention only when it becomes somatically registered.
Meaning boys often only get help for mental distress once it shows up physically.
That's the observation. And it's contrasted with what some have called a normal pathology of normative femininity in girls.
A normal pathology. What does that mean exactly?
Well, it suggests a historical tendency to view typical female ways of expressing distress, maybe especially around relationships or social expectations, as somehow inherently problematic or unhealthy, rather than just different responses.
So a kind of bias in how distress is seen and treated based on gender, especially when it shows up in the body.
That's the implication raised. It's a striking difference.
Okay, so if the patient's body is so central, this raises a big question. What about the analyst? What role does their embodied presence play in the therapy?
It's absolutely crucial. The thinking now is that effective practice really requires holding this tension of one-person and two-person psychologies at the same time.
One person and two person, meaning?
Meaning you're looking at the individual's inner world, one person, but you're also deeply aware that this is happening within a dynamic relationship, two-person. They influence each other constantly. Look deep into one, you find the other.
Okay, and the analyst's own body is part of that two-person dynamic.
Absolutely central to it. Our sources include this incredibly moving personal account from an analyst who went through breast cancer. She talks about how fraught it can be for any woman, let alone an analyst, to discuss her breasts in a professional context, especially in the analysis.
I can only imagine. and she decided to disclose her illness to her patients.
She did, driven by this deep sense of responsibility, which she connected to her own childhood experiences with her mother's unpredictable distress. She didn't want to repeat that uncertainty.
That takes courage.
Immense courage. And she puts it so powerfully. The body is the visible and palpable container of these phenomena. Life, change, loss, grief. It holds it all.
And her patients dream about her. That was intense.
Wasn't it? You are very pale. Your skin looks awful. I ask if you are in pain. No, you say, I'm not in pain. I'm dying, but I'm not in pain.
Wow. Just shows how deeply the patient was processing the analyst's embodied reality, her vulnerability.
Exactly. And then there's that lovely image from another patient wanting to feel as comfortable in my body as one can be in an old sweatshirt.
An old sweatshirt. Such a relatable longing for what the source calls psychosomatic unity, right? That feeling of mind and body being seamlessly integrated.
Precisely. And it really emphasizes the analyst's job, staying physically present, attuned to their own body stuff to create that safe holding environment.
A holding environment where difficult things can surface.
Yes.
Like enactments.
Yes, enactments. Those moments where the past story, the unresolved issues kind of get under the skins and into the bodies of both patient and analyst. They get played out, not just talked about.
So it becomes very real, very present in the room.
Very. It has to be felt together to be worked through, making the abstract concrete, you could say.
There's also that vivid example with the child patient and the piglets.
Oh, the piglets, yes.
Yeah.
The analyst used her own spontaneous and aggressive physical play wrestling with these piglet toys to help the child express deep attachment needs.
Needs he couldn't maybe put into words.
Exactly. To help him move beyond what was described as a bitter, disembodied despair. It was playful, but profoundly therapeutic, using her own body to connect.
And in the phallic rivals case, that sounded challenging.
Very. A patient struggling with masculinity, his absent father. It manifested in this dynamic where he and the male analyst were almost literally sizing each other up, physically in the room.
They're sizing each other up. Wow.
Yeah. And the key insight came when the analyst became aware of his own body feeling tense and unfree. That physical clue alerted him to the rigid, competitive pattern they were stuck in.
So his own bodily reaction was like a diagnostic tool.
Invaluable, providing nonverbal information about their dynamic.
So if we pull back again, all these examples, they really show this shift in modern psychoanalysis, right? Moving away from that rigid, what was it, Cartesian split.
Exactly. The Cartesian split Descartes separating mind and body. Psychoanalysis is moving towards a much more holistic view, seeing complex human stuff as a flexible, plastic, and multivariable outcome of interactions across persons and within body and mental life. It's all interconnected.
It even mentions two-person biologies, matching two-person psychologies, like our physical states influence each other in the room, too.
That's a cutting-edge idea, yeah, that the interaction is so profound it might even register biologically between two people. It emphasizes this deep, dynamic intertwining.
Fascinating.
Yeah.
And within this, self-awareness. It's not seen as the starting point, but more like the goal.
Right. The goal of analysis isn't necessarily that you arrive fully self-aware, but that the process fosters it, including what's called healthy dissociation.
Healthy dissociation. That sounds like a contradiction.
It does, but it's not about escaping reality. It's more about developing the capacity to hold multiple perspectives, multiple feelings, different self-states simultaneously, without getting completely overwhelmed or losing touch with any of them.
Okay, so like being able to stand in the spaces between realities without losing any of them.
That's the phrase used, yeah. It involves cultivating this internal dialogue of the multiple voices of subjectivity, accepting complexity within yourself.
And language is key here too, but in a complex way. It can trap us.
Right. Naming things can sometimes create prisons, embody oppressive social forces, lock us into labels.
But analysis can also help us. What was it? Contest, respeak, and reclaim names.
Exactly. To undermine authority, including the authority of limiting labels. Language, like an artist's paint, it both constrains and frees. It's about finding agency within language.
Transforming the words themselves, not just using them.
And that final image, the patient visiting his father's grave after 25 years.
Oh, that was powerful. With his own son there.
Yes, his son's grasping body literally holding on to him in the sense of phallic bodies in the room, symbolic connection, masculinity maybe. It all led to this profound visceral recognition that something lost had been retrieved.
Visceral. Felt in the body.
Totally embodied, a moment of deep integration where the physical act, the presence, brought emotional wholeness.
So, wrapping this up,
Mhm.
what does this all really mean for you listening? We've done this deep dive, and I think the takeaway is that the body, it, it's so much more than just a container, isn't it?
Oh, absolutely. It's like a living archive. Holding our experiences, relationships, traumas, our deepest truths. It's not separate from the mind at all.
No, it's intricately woven into every single aspect of who we are, our selfhood, and crucially, our capacity to heal.
Which really raises an important question for you to think about. What new insights might you gain if you started paying maybe closer attention to the subtle cues, the communications your own body might be trying to send you?
Yeah. How might truly listening to your body help you, as the source says, stand in the spaces between realities without losing any of them? Not just in your head, but in your actual felt experience of being alive.
It's a big question, this deep dive into the body. It really feels like just the beginning of understanding the profound wisdom our physical selves hold.